Mentally ill people in America are misunderstood. Why do I say this? I think that mental illness is rare and doesn't affect many people. Roughly 1 in 5 American adults will experience a mental illness at some point in their life, according to a 2017 survey by the National Institute for Mental Health. Another 1 in 25 will experience a major mental illness at some point in their life. 1 in 5 means that someone you know at some point will experience a mental illness. Another common misconception is that mentally ill people can snap out of their depression or their mental illness. This is false, as many mental disorders are caused by traumatic events or by biological factors. Along with the fact that to treat mental illness, it usually takes either medication or it can just take psychotherapy. For instance, schizophrenia can be caused by too much dopamine and too much glutamate in the brain. Depression comes in many forms. For instance, seasonal depression occurs in winter months when it is darker outside. Persistent depression occurs when someone has depression for 2 or more years. Postpartum depression occurs in women before, during, and after they give birth to children. Psychotic depression occurs when someone has a major depression and some form of psychosis. Depression usually is due to serious illnesses, genetic factors, medications, or a history of depression. Depression is treated usually in 1 to 2 different ways. It can be treated with psychotherapy, where you try to talk to your therapist to try and solve the problem. It can also be treated with antidepressants, which use chemicals to try and bring balance to your brain. Sometimes both are needed to treat a person with depression. Schizophrenics, on the other hand, require antipsychotics to stop symptoms such as hallucinations, unrealistic thoughts and feelings, and other symptoms of schizophrenia. Attention, impulsivity, and hyperactivity are 3 signs of ADD. ADD usually runs in the family too. Stimulants and non-stimulants can be used to treat ADD. Bipolar disorder is shown as the person will have mania at some points and act depressed at others. Bipolar disorder can be treated by using mood stabilizers, atypical antipsychotics, antidepressants, and psychotherapy. Panic disorder is when you experience recurrent panic attacks or abrupt surges of intense fear or intense discomfort. Panic disorder may be genetic, as it runs in families. These can be treated with either or both psychotherapy, beta blockers, selective serotonin reuptake inhibitors, serotonin norepinephrine reuptake inhibitors, or benzoiodiphenes. Anorexia is an intense fear of gaining weight. Anorexics tend to be perfectionists, overachievers, and may have a family history of anorexia. Anorexia can be treated with continuous medical care, regular therapy, nutritional counseling, and antidepressants. PTSD is when you have flashbacks, distressing dreams, memories of events, and the avoidance of distressing thoughts and memories and external reminders. War veterans, people who've been through physical or sexual assault, abuse, accident, disaster, or other serious events are more likely to have PTSD. PTSD can be treated with psychotherapy, antidepressants, or both. OCD is a recurrent, persistent thoughts that are intrusive, followed by repetitive behaviors or mental acts that individuals feel driven to perform. Genetics and environment are both risk factors for OCD. OCD can be treated with serotonin reuptake inhibitors, selective serotonin inhibitors, or psychotherapy. Antisocial personality disorder is a pattern of disregard for and the violation of the rights of others. Antisocial personality disorder can be treated by behavioral therapy, psychotherapy, mood stabilizers, and atypical antipsychotics. People with antisocial personality disorder are usually called psychopaths. When I say mentally ill people, what do you think of? Most people would probably say dangerous psychopaths. But what if this wasn't true? Mentally ill people aren't any more dangerous than your average person, according to a 2008 study in the Bipolar Disorder and Violent Crime. New evidence from population-based longitudinal studies and systematic review. These both showed that when you remove substance abuse cases, where there is the confounding variable of whether it be alcohol or other drugs, that mentally ill people are no more likely than the general population to commit violent crimes. These stigmas are harmful to mentally ill people as it can hinder their already low self-esteem and cause them to not get help to avoid being labeled mentally ill. Avoiding these stigmas would help mentally ill people as it would be respectful of them, help them not feel crazy, and encourage them to receive treatment. Sharing facts about mental illness can also help by reducing other stigmas and spreading awareness. Stigma at the workplace about mental illness caused 49% of people in a survey that had depression do not tell their employers as they feared losing their job. It also caused a lack of productivity as 40% of those diagnosed with depression took time off to deal with it. These were the results of the impact of depression at work audit. Due to this, I believe jobs should have resources where workers can help their mental health to improve their employees' mental health. This would not only help the workers who would not have depression anymore or not have their mental illness, help them get done with it. It will also reduce stigma and improve productivity at the workplace. This would increase profits for these businesses by $44 billion as that is the estimated loss of work that each year due to depression, according to the cost of lost productive work time among U.S. workers with depression by Stuart W.F., Ricci J.A., Chi E., Han Sr., and Morgenstein D.